Hey, it's Dr. Sean Billings, Premier Alternative Health. I wanted to do an introduction for our foam roller series. We have a bunch of different exercises on how to foam roll upper back, low back, and lower extremities and things. So foam roller, this is what it looks like. You can find them at any sporting goods store. This one, they range from like $20 to $200. The $20 one is just a dense foam roll. They work great. You just lay on them, you roll through those tissues. This is the $200 version that vibrates and it'll shake your teeth loose almost. With the foam rollers, you're going to lay it on the ground, you're going to lay on top of it, you're going to roll through those muscle groups, and you're going to find those really tight muscles in there. You're going to sit on those for 30 to 60 seconds. It's ischemic compression, it's compression massage to get those muscles to open up and relax. This is kind of your go-to tool when you're having a rough day. Those muscles are tight and sore. You want to hit this, hopefully, take care of it before you have to come to my office. But use these tools, look at the videos that follow, and it'll show you exactly how to work through those different muscle groups. If you have any questions, give us a call. Sean Billings, Premier Alternative Health. Thanks. Middle back foam roller exercises on the side musculature. You're going to start with the foam roller in your mid back. You're going to lean off to the side so your spine is on it at about a 45-degree angle, and you're just rolling through the muscle tissues on one side of the spine. Slowly roll up and down through the tissues with your hands behind your head, and your legs are the ones pulling through those tissues. When you find a tender spot or a spasm muscle, sit on that, rock on it back and forth for about 15 seconds to 30 seconds, and then continue on. Low back foam roller exercises. Start sitting on the foam roller with your hands placed behind your back on the ground, fingers and palms facing forward. Slowly roll up through the lumbar spine. You want evenly distributed on both sides of the spine with the foam roller, and use your legs to move up and down. If you need to take more pressure off of your back, you can support yourself better with your palms or with your legs. When you get to a hot spot or a tender spot in that low back, sit on it for about 30 seconds, work through those tissues, and then keep rolling through with it. Low back foam roller exercises number 2. This is to focus on the side musculature. You're going to sit on the foam roller again with your hands supporting your upper body behind you with your fingers facing forward. And your body is sitting at about a 45-degree angle. And you'll slowly roll from the gluteal muscles up through the low back muscles. And when you find those tight spots or those tender spots, you're going to sit on those for about 30 seconds. Slowly rock back and forth on those, and then keep rolling through those tissues. Make sure you're supporting yourself with your upper back and with your legs and pulling through with your legs. Piriformis foam roller exercise. You're going to start by sitting on one of your gluteal cheeks, and you're going to slowly roll down into the upper lumbar spine or the upper back. And on this one, you're actually going to rock in and out, to sitting flat on it, to rocking to the outside of your hip as you roll up and down to find those hot, tender spots on that low back and that piriformis muscle. When you find those tender spots in that piriformis muscle, you're going to sit on it, stay there, and just rock back and forth on that for about 30 seconds. Lower extremity foam roller exercises. This is for the hamstrings. When you're working the hamstrings, start by sitting on it. Keep your legs straight in front of you, and you're going to slowly roll from the gluteal muscles all the way down towards the knees. And you start with both legs on the foam roller. As you're doing this, you're going to have to pivot your pelvis in and out to get the inside of the hamstring and the outside hamstring muscle. Often you need to actually cross the legs and just focus on one leg. And you once again work on that outside hamstring, and then you'll have to rotate in to get the inside hamstring also. Depending on how tight your hamstrings will dictate whether you cross your legs to focus on one leg or whether you leave them uncrossed to focus on both legs. Most of your weight is supported on the foam roller and on your hands. Okay, foam roller exercises for the quads and the legs. You're going to start with the foam roller underneath your pelvis, and then you're going to roll down into those quad muscles. And with this one, go slow, and you're going to roll down into that knee And then as you come back up, you're going to have to pivot that pelvis inside and out so you can hit the medial portion of that muscle belly and the lateral portion of that muscle belly. So the inside and the outside of that muscle belly. Most of the weight is going to be on your hands and on the foam roller. If it's too tender, you can put your feet down and drag them to take a little pressure off of those of the muscles in the front. Foam rolling exercises for the inner thigh. You're going to start laying on your hip and having the foam roller under your other leg that's at a 90-degree angle. Start it at the knee and you're going to slowly roll into that inner thigh. Most of your weight is going to be on your elbow and hip when you start, but as you start rolling through that inner thigh, you're going to pick your hip up off the ground and put that pressure onto that foam roller. Once again, find the tender spots, sit on them for about 30 seconds.